As Primary Care Plus, which is sort of the big overarching community interest company, we started an extended access service.
We won the bid for a pilot for extended access, which is evening and weekend appointments, and we started doing a visiting service for the frail and elderly from October of last year.
You've got to make a start and you've got to face the challenges. We can't do what we've always been doing, and general practice is very good at burying the head in the sand and thinking the problem will go away. It won't. The recruitment crisis is a lot bigger than that's on the TV. You know, most practices have got a recruitment crisis with GPs, with nurse practitioners, with practice nurses.
We really got on with it. So from a support perspective, we didn't get a lot of external support. We got on with it, and I think actually that's been the benefit of what we've achieved, is that we've been left to just do what we want, really. So this has really been about 16 practices working together and using their own individual skills to benefit the project. So one person might be very good at IT, another person might be very good at another aspect, and it's putting those sort of heads and skills together. So I think use the people that you've got in your room to the best ability.
We'd rather lead than follow. It's been the philosophy for the practice ever since I joined 20 odd years ago. But also, this is a great opportunity. It's all right moaning about primary care, general practice, but actually this is an opportunity to do something that makes a real difference. You know, we've seen over 30,000 patients in the extended hours service so far, and we're coming up to 2 years. So that's 30,000 appointments that we've had at no cost to our practices, but actually we're here for the patients, so the patients have accessed those services that they just wouldn't have had.
The feedback from patients has been very positive. So taking extended access, they've found that they're able to get appointments in the evenings and weekends, which for someone who works weekdays, work professionally from 9 to 5, they often struggle to get the appointments that they need. In the extended access, you have 15 minutes per patient, and if you're doing an evening, it might be 2 hours, where you have just that time dedicated to see those patients, and you're not having to answer phone calls or deal with any administrative work. And it's quite a pleasant atmosphere.
I had a vision of what I felt that service needed to look like. We did quite a lot of work around the types of things that GPs would normally go out to visit. When we looked at that, we then said, okay, if that GP hadn't visited, who else could? So we then started to sort of develop an idea of a team and what that might look like. So it did involve paramedics, pharmacists, community matrons, and a very, very different range of people that would normally go and see these patients. So one of the challenges that we had was then to convince that the people that provide that resource to actually work differently with us, to take away the known of what their caseload was and actually look at a proactive and a reactive care for that patient.
With the visiting service, they get the visits earlier in the day or when they need to, really. So again, it's been positive because they've had that flexibility of the time, they've been seen by the right person, and the clinician's been able to help them with their problems.
We do visits throughout the day in blocks, so everything is linear. So you only have an hour and a half of anything. So things like telephone triage, if you got Monday morning, you could be doing 70 calls, but now you've got to start. Prescriptions, you've got to start. So visits go all the way across. So actually, there is somebody visiting from the practice. So the on-call responsibility is diminished considerably, and that person who's on call has the last visiting slot. So they'll be visiting between sort of 4:30 to 5:30. So actually, on call is diluted. We still do it, we still see the same number of patients, but it's not all on one person.
I knew what I wanted. I knew what the group of patients needed in order to enable them to stay at home, to not have so many visits by different people that really didn't understand their care. So I think that's what drove me on to sort of convince people that actually this is the right way forward for that patient. So we've sort of said, palliative end-of-life care should remain with the practices just for continuity. And I think what is happening now is that those patients and those GPs are able to actually focus on that area. So I think all in all, there's GP satisfaction, because I think that's the sort of thing that they like to do well. And I think from the family viewpoint and the patient viewpoint, they're getting good care. So currently it sits at between 98 and 99% that patients are really satisfied. I think one of the barriers that we had initially with the visiting service was that the patients wanted their own GP, but then now we're getting feedback saying, oh, will you come again? It was lovely to see you. I like having a paramedic with us. So it's a totally unexpected difference in what I sort of thought would happen, really.
The feedback is from some of the GP partners is, I can carry on being a GP partner because of this.
You always come across the phrase, we haven't got the resource and the time to do it. And I think that my challenge was to say, we're not asking you to buy more people in, we're just asking you to look at letting us work with them very differently.
And people who previously would never have spoken to a practice, I don't even know whether they'd be allowed to talk to a practice, we're actually got a voice now. And, we get invited to attend things, and we think, oh, crikey me, we're sitting with the decision makers, which is really empowering.
People want to get involved with new projects. There's that flexibility for working, and just gives a different style to general practice.
I actually thought when we first started, is this going to be my life for the next 20 years? God, I won't be able to do this. But actually, the benefit, I think it's perhaps one of the most rewarding things I've done in my career.